So I'm Jitender Sareen. I'm professor of psychiatry, psychology, and community health sciences at the University of Manitoba. And all of us have been touched by mental illness with friends and family members that have gone through depression or schizophrenia. And so that really motivated me to see lots of barriers for people. One of my early experiences was being a medical student, seeing people who had been dealing with lots of stress and dealing with chronic pain as well as depression, anxiety, and having thoughts about suicide. It really got me interested in understanding why some people who have the same stressor compared to another person that has the same stressor recover and grow while others develop depression and PTSD and suicidal behavior. We've been really working on improving access through innovative ways of providing care, using online technology to provide cognitive behavior therapy, large classroom size psychological interventions, but really trying to figure out what does the person want as far as care and using novel ways to reach them. And we have to look at new ways reaching out to people, telephone, telehealth, computer-based psychological assessment and treatment. In the last 20 years, my main research has been to try to understand what are the population level needs of mental health problems. So we showed that in the active military in 2007, that untreated mental health problems was a major issue. We've had the opportunity to present to the House of Commons standing committees on veterans' health because our research has had a significant impact. There are increase in number of clinics across the countries so that military and veterans can get appropriate access to treatment, and we think that our work has gone into that. We've really worked hard at trying to understand suicide risk from a public health perspective. We've shown that financial stress increases the risk of depression and suicidal behavior. We've shown that First Nations communities dealing with racism, dealing with poverty, housing issues, that is a strong risk for suicide, as well as mental health difficulties. Our hope is to increase awareness about suicide in Canada and the need for suicide-specific treatments like cognitive behavior therapy that specifically target suicidal behavior and help people figure out reasons to live and not attempt suicide again if they've done it before. We've shown that anxiety disorders negatively impact physical health outcomes. Anxiety disorders often precede and come before depression and alcohol and substance use problems. And so early treatment of anxiety is likely to help improve outcomes. And that what we know is that people often suffer with anxiety disorders for 10 to 15 years before they get care. And that it's really important to make both people who are suffering with it to get care, but also clinicians to recognize anxiety early, help with appropriate treatment so that we can prevent later depression and suicidal behavior. About 10 years ago, there was quite a bit of controversy on whether anxiety disorders increase the risk, but our group did a series of studies that showed that if you had an anxiety disorder or post-traumatic stress disorder, you had a 2 to 3 times likelihood of later developing suicidal behavior. Those series of studies has really impacted the field, and people are more aware of assessing for anxiety when people present with suicidal behavior or assessing suicidal thoughts when somebody presents with anxiety. Homelessness is a major public health issue in Canada. We've worked with the Housing First project with the Mental Health Commission of Canada. Our city was involved in that, and we had 500 people in Winnipeg. 70% were First Nations who were homeless and having difficulties with mental health. We were able to help them get into housing and recovery, and this is something that's really had a huge impact in Winnipeg, but nationally on improving the awareness of homelessness and honored to receive this award. And Dr. Lal and the Boeckh Foundation have really had a major impact on Canadian psychiatry, really aiming to try to improve care. I'm blessed to have a great family and a number of mentors and colleagues that have made the research successful. And so I want to share this award with them.